Catherine decided having a LASIK eye surgery to stop the hassle of wearing contact lenses. I will explain you the whole procedure today. So we will start with our examinations to see if... Serap was born in Germany and lives in Izmir since 5 years. She will provide language assistance and will accompany both throughout their laser vision correction journey. The whole procedure is explained in detail, so both know what is expecting them. There's also a cornea illness, keratoconus, and we have to know if you have it or not. This is the most important thing. And then we will go to the doctor and we will check again the power of your eye, so you have to read letters and stuff. And then you will get some drops to widen your pupils, and then we have to wait half an hour. And the second part would be we will again check your powers and then see if your retina, the behind of your eye, is healthy. Okay, but this is the most important exam. This is a topography to see if your cornea is healthy or if it is thick enough. Eva and Catherine have chosen to come to Kaskaloglu Eye Clinic in Izmir. The hospital's experienced team of surgeons offers quality laser vision correction at affordable prices and is focused on patient satisfaction. Eva has been born with eye defect +8 dioptrin in both eyes, which has been reduced to +8 dioptrin plus astigmatism. She was wearing glasses for 14 years and contact lenses for 16 years. Eva was thinking to have an eye surgery since 10 years, but it seemed impossible back then. After long investigations, she visited the TÜV certified clinic. Dr. Bilgin Asena is specialized in refractive and cataract surgery. She personally performs more than 1,000 eye surgeries every year and is experienced in dealing with foreign patients. Now we have to wait half an hour. The reason why you got your drops is to relax your eye muscles, because the eye is a moving organ. So if you're tired, if you're stressed, the dioptry numbers, the powers can change. Now a retina check has to be performed.
Everything is okay for the LASIK operation. We can perform LASIK today for you. Is there any question about the operation?
Serap already explained everything.
Yes, I recommend femtosecond laser for you, for everyone, because this is the latest technique, the best technique, you know. And you have mixed astigmatism. Your vision capacity is not 100% line, you know this. In the right eye, you can see 70%. In the left eye, you can read 80%. Okay? We will correct your number totally, and after that, you can see without glasses. Okay?
Wonderful.
Catherine was self-conscious about glasses, and after 10 years of wearing contact lenses, she developed an allergy. Her boss recommended her the clinic, after he had an excellent service here.
Everything is okay for you too. Okay. I recommend femtosecond laser for you.
Okay, I just want to ask you, what were you expecting in coming Turkey and to the hospital?
Well, I was worried about the language because I don't speak Turkish, but all the doctors here speak English. The staff also speak English, and also we have someone to accompany us all the time who speaks English fluently. So it was a big weight off my mind.
That's good. And you?
Well, to be honest, I was not worried about anything like that. But my parents, who are still back in Poland, they have this vision of Turkey as a country where you go to the hospital, they do something mysterious on you, and then you come out in unknown state. So that's what really surprised me. And my parents, I'm really glad they will be able to see this.
Okay.
Because the standards are really, really nice. The rooms, everything is very hygienic. You don't feel like you are in a country that in my country Turkey is. The Turkey is being perceived as a third country sometimes, especially in my country. We use words dirty, not hygienic, and I would like to say that it's nothing like that. The hospital is really modern. When we were having examinations, the machines that were being used to examine me are more modern than my optician is using, to be honest with you.
As an ex-nurse, I do think that this hospital is incredibly clean and modern. It's more like a hotel than a hospital, which is something that I look for because obviously cleanliness is very important with surgeries. Well, it's met my standards, and in fact it's gone above what I expect.
Now it's time for surgery. Are you ready?
Yes.
Yes. Okay. So I will just give you some information. So you will get 2 drops. This is your artificial teardrops. This is antibiotic cortisone. Although the eye will move during the surgery, the eye tracker ensures patient safety when this happens. Compensating for eye movement is a key factor in ensuring that the laser pulses into exactly the right place. Laser eye surgery is safe, but no surgery is entirely without some level of risks. The fact is that an expert surgeon will have the knowledge to manage complications properly and will often be able to correct any complications that do occur. In the hands of an expert surgeon, the chance of something going wrong is around 1 in 1,000 procedures. So this can take like 4 hours. So the best thing is just go to your hotel or to your home, to your place, and sleep for 3-4 hours. Finally, after all this excitement, Eva will know how it feels to wake up and see the world without help of any equipment.
Is your name Eva Niemiarczkowska?
Yes, it is.
Short-sightedness, far-sightedness or astigmatism are all due to not focusing precisely to the retina. Surgeons can correct this by using a laser to reshape the curvature, the front surface of the eye, called the cornea. The surgeon operates on one eye at a time. She cleans the eye, the lid and the lashes with antiseptic and administers anesthetic drops to freeze the eye so the patient doesn't feel the pain. She opens the lid wide with a spatula and rinses the eye. Then antibiotic drops to prevent infection. She positions a small suction ring around the cornea to fix. Now the intralace will create a flap of tissue in only 18 seconds. Next step is the excimer laser, where the cornea will be reshaped. The excimer laser, an invisible light, fires computer-controlled pulses. It works by breaking molecular bonds. The laser has been computer programmed beforehand, so it knows exactly how to reshape the cornea to give the patient the maximum vision. In less than a minute, it's done. Within 45 seconds, the negative pressure inside the cornea sucks the flap back on. A little bit red, So Eva, how do you feel? How was last night?
Right after operation, I thought I'm so perfect, but after anesthetic left, its effect, it stopped. I thought I would kill someone. It was a little painful, but I managed to fall asleep, and 2 hours later I woke up completely without any pain.
Okay.
And I was able to watch my game. I was in heaven. Actually, I was texting everyone, people I'm seeing without glasses, it's unbelievable. And today in the morning I woke up with a little blur vision because I was plus.
Yes, this is what I meant yesterday, yes, okay.
I had plus numbers and minus astigmatism. Here they told me it's a mixed defect, so it's a little bit complicated. But I still can see. I don't have the feeling that I need to put something in my eye. Like I used to wear contact glasses and I always had to turn them. So I'm feeling very good.
Your vision will be fixed after 3 months. So because your eye muscles and your brain have to accommodate, so it takes time, of course. So don't worry if you see sometimes more clear and sometimes more blur. This is normal, okay? When you have to be worried is if you have pain. This only happens if you really have a trauma, like if you rub your eye or someone kicks you in the eye, then you will have pain, then you straight away come here, okay?
Okay, I was having a nice sensation when I was walking on the street, because my concern was if I'm able to function normally. From the distance I couldn't see people clearly, for example, but when they were coming closer, I was like a digital camera, zooming and focusing. Very interesting.
The doctor examines the eye with a high-powered microscope to make sure the flaps are wrinkle-free.
How old are you, Eva?
32.
32.
Yes.
Your life will going to be changed. Now, you will have 3 kinds of problem. First one, when you wake up in the morning, you will feel a little bit dryness. Especially, a little bit hard to open your eyelids, but
Today
you
it
will
was
get
perfect,
used to
nothing.
it. The second one, you will be very sensitive to light or sunlight. The third one, your vision will be sometimes more clear, sometimes blurry. These sometimes last 3 months, sometimes 3 weeks. It depends on you.
Yesterday I had the laser eye surgery operation. The operation went very well. I was a bit nervous before the operation, but very, very excited. And the operation was fine. Slight pressure, but no pain whatsoever, no discomfort. And the staff were wonderful here. A nurse held my hand throughout the procedure, which was excellent. Then after, I was warned that there would be some discomfort for between 1 and 5 hours after the eye drops wore off. I did feel discomfort for about 2 hours, a bit like having soap in your eyes. But it went away with some paracetamols, and I was able to sleep for about 4 or 5 hours. And then as soon as I woke up after that, all the pain, the discomfort, everything was gone, and I could see, which was wonderful. Today, the second day, I can see perfectly. I have 100%, I suppose, vision, which is excellent, exactly what I wanted. There is no discomfort, no aching, nothing whatsoever. I have slightly bloodshot eyes, but that's to be expected. I was warned about that, but there's no discomfort, and it should go away in about 2 weeks. I think the worst thing is that I can't wear mascara for 2 weeks, but that's the price to pay for perfect eyesight.
After laser eye surgery, all patients can enjoy added peace of mind with the benefit of 24-hour medical helpline. This service allows patients to speak to one of the laser-trained English-speaking staff with any post-operative questions they may have after their laser eye surgery procedure.